for being here today. Karen will get our slideshow set up here today. Also with us today, I'd like to recognize Ann Wargo in the back. Ann is with Summa Health, and she is on our YMCA Board of Trustees and agreed to be the chairperson of our Community Advisory Board. Also manning our table at the back is Gary Lake. Gary is the Health and Wellness Director at the best YMCA in our system, the Wadsworth YMCA. That's where I live, in Wadsworth. So the title of our presentation today is Measurable Progress and Unlimited Support. Measurable progress. Diabetes, the Diabetes Prevention Program. Helena, good to see you. Thanks for coming. Helena is also with the YMCA and is one of our chief folks moving our mission advancement forward. Thanks for being here, Helena. The diabetes program is an evidence-based program, and this program is new to us at the Akron area YMCA for the last 2 years, but I guarantee you it is not new because of the research, years and years, decades of research by the National Institute of Health and also the Center for Disease Control and Prevention, which we will now refer to going forward as the CDC. That's one of the acronyms. The YMCA is great about acronyms, so if we toss out an acronym that you don't know, please raise your hand. So unlimited support, measurable progress. This program is definitely data. The program is fanatical about data collection. Essentially, two goals of the program: lose 7% of body weight and increase activity minutes to 150 minutes a week. Donna kind of mentioned that earlier in her comments about eating well and moving. So this program is really an evidence-based program. Unlimited support. The CDC has partnered with the YMCA of the USA to bring this program to communities throughout the United States. In fact, Donna gave the Y credit for the food today. The credit really belongs to a grant that we received from the CDC, one of 17 YMCAs across the country that received a grant to help connect with employers just like you. The CDC knows if we're going to be effective with this program, we need to get the workforce involved in telling their employees about prediabetes. So thanks to CDC for the food that we have today. Unlimited support. The YMCA of the USA, this is a program that we didn't create locally. Again, it's a program that was created by the National Institute of Health and supported by CDC. Currently, more than 252 YMCAs across the country are providing this program. Unlimited support. Locally, we're so blessed to have Summit County. Jeff in the back, Jeff Krause, is a member of our Community Advisory Board, and Summit County Health was one of the early signers on to this program to support us bringing this to the community. Lisa will talk about the other member organizations that are involved in our Community Advisory Board. And then unlimited support, certainly the people on the front line of this program are the lifestyle coaches, those folks that are trained to facilitate a small group of folks in a class setting. And then unlimited support, certainly from the fact that this group of people, a small group of people, come together, and it's really those individuals working together that supports their effort to prevent them going into type 2 diabetes. So our presentation today, I'm going to share with you a little bit more about the need for the diabetes prevention program. Karen will talk about the YMCA's diabetes prevention program, the only program in Summit County that is currently recognized by the CDC. And then Lisa will talk about partnership opportunities. Again, hopefully we can engage you in telling your employees about this program. At your places, there's a contact information sheet. Again, since we're here because of a grant from CDC, they really want to make sure we connect with you. So hopefully one of the next steps will be you'll fill out that contact information sheet. when we're done and either give that to Gary or give it to Karen after we're done. Guarantee you, if you fill it out and we contact you once and you say you're not interested, we won't bug you again. But it'll be extremely helpful for us going back to our funder to say we had 30, 40, 50 companies that were interested in learning more about this particular program. Also, under next steps, we'll certainly give you an opportunity to ask some questions. Diabetes is an epidemic. It's a chronic disease like cancer and like heart disease. These three chronic diseases account for 7 out of 10 adult deaths, 75% of our annual medical costs, and then certainly, as you all know, a major burden as an employer. Not only the medical costs, but also, as Donna mentioned, the lost time for someone that has one of the chronic diseases. But unlike heart disease and cancer, diabetes does not have a cure. Once you get it, you've got it. And the best you can do is manage it. That means managing it with good medical care and potentially lots of dollars. It is the leading cause of new cases of blindness, kidney failure, lower limb amputation, and neuropathy. I thought I wasn't going to be able to pronounce that word, neuropathy. And of course, that's pain, numbness, and weakness in your feet and your hands. A definition from the American Diabetes Association about what diabetes is. This is the simplest definition. Type 2 diabetes is a problem with your body that causes blood glucose, sugar, to rise to levels higher than normal. Type 2 diabetes is the most common form of diabetes. And although there are several symptoms of diabetes, most people aren't really able to detect those symptoms because they're so mild. Diabetes can affect anyone, men, women, rich, poor, black, white, Hispanic, Asian. And I know from a couple of personal experiences, my next door neighbor, Marty, a woman who's probably 15 years younger than me, is now in advanced stages of diabetes. 3 times a week she goes to kidney dialysis. And my wife attempts to help by taking her to the grocery store, and she's on one of these mobile carts. And because neuropathy is beginning to affect her hands and her feet, oftentimes it's pretty scary to be around her when she's driving this cart through the store because she's kind of out of control. A friend, Jerry, from a Kiwanis organization, about my age, also had advanced stages of diabetes, neuropathy, began to lose balance, broke knees and broke elbows and broke hips, and ultimately died, not as a direct result from the disease, but from the complications of the disease. So the good news, enough of that gloom and doom stuff. The good news is this is an example of a diabetes prevention class. You can see a lifestyle coach facilitating the group, and people from all walks of life have come together to support each other in this challenge to prevent type 2 diabetes. Oh, sorry, back to gloom and doom. Trends. Trends with obesity and diabetes. From left to right, and again, this is information from the CDC, from left to right, data that was collected from 1994 to 2013. The top line is obesity. The bottom is the rates of diagnosed diabetes from 94 to 2013. Essentially, the light colors on the obesity side indicate that at that point in 1994, less than 14% of our population was obese. And fast forward over to 2013, greater than 26%. On the lower chart, diabetes, less than 4.5% of folks diagnosed with diabetes, and then 2013, 2013 increasing to over 9%. If you look at Ohio right here, the Ohio Department of Public Health, this idea of diabetes being an epidemic has not failed to get their attention. I know our folks in the back, Summit County Public Health, have been able to secure a couple of grants to help us with this particular program. In the back, Tamika has been able to get bus cards on our metro buses that talk about the fact that 86 million Americans may have prediabetes. They've also been able to secure some funding to get this information out into doctors' offices. They've also helped us with stipends to help folks from low-income families to help with to get engaged in the program. The takeaway from this slide is diabetes and obesity go hand in hand. In fact, diabetes follows obesity like night follows day. This image of an iceberg is a great representation of diabetes and the prediabetes issue. When I was in the Navy in the late 60s, early 70s, when you're on top of the ocean, it's an amazing view. I never saw an iceberg. I was always in the South Pacific. But if I were to see an iceberg, what would I see? Just the very tip of the iceberg. In this case, diabetes currently in our country, 29.1 million people already have type 2 diabetes. Below the tip of the iceberg are the folks that are pre-diabetic. 86 million Americans, almost 37% of all of our adults, with a progression rate of diabetes at 10% a year. That's why this is considered an epidemic, because these folks that are below the waterline are eventually going to move up into that diagnosed phase of diabetes. The other scary part about this is that only 10% of the folks that are pre-diabetic know about it. Of course, there are many reasons. Certainly some folks that don't have health insurance aren't getting regular checkups, so they're not getting a blood screening. As I mentioned before, diabetes itself doesn't have major symptoms, so folks that are pre-diabetic are even less likely to know that they're on the way to develop type 2 diabetes. In 2013, just before I was beginning to retire from the YMCA, I learned about this program and realized how important it was for our community and our YMCA to get involved in this program. So this is our Summit, Medina, and Portage County iceberg. When we started doing the research for the need for this program in our community, we found that in Summit, Medina, and Portage County, 66,000 people already have type 2 diabetes. Unfortunately, this program is not for them. It's for the folks that are below the tip of the iceberg, the more than 239,000 people that are pre-diabetic. And then, in the same way, 10% of those folks that are pre-diabetic don't know that they're pre-diabetic. As we began to learn more about this program, the mantra for this program is, if you build it, they might not come. It comes from the Field of Dreams. If you build it, they will come. In this case, the reality is, we can start this program in this community. We can build the program from the ground up, but there's a good possibility they're not going to come because they don't know they're pre-diabetic. And that's certainly where you come into this opportunity to join with the YMCA to tell your employees about this dreaded disease. Certainly, through our Community Advisory Board, we have built referral networks to help identify and refer people to this program. We have a number of doctors that are referring their patients as they see those numbers starting to rise and they're moving towards diabetes. They contact Karen and let them know that this person is pre-diabetic and they want to be involved in the program. There are a couple of insurance companies that already cover this as a defined benefit within their within their scope. And certainly Lisa will talk more about some other community partners. John Dimmick is here with the Richmond Pharmacy Organization, and they're one of our partners and will help us with helping to identify people that are pre-diabetic. And of course, hopefully the call to action is for you to be engaged in this effort to tell your employees about this disease and about pre-diabetes. And I want to give a shout out to Summa Health. Summa Health will be the first company in Summit County to sign on to this program. They've agreed to provide the program as a benefit to their employees for 75 employees, and those classes will start later this fall. So what is the cost of doing nothing? From left to right, you can see the numbers. Annual out-of-pocket medical cost for someone without diabetes is estimated to be $3,600. And then you can see that out-of-pocket expenses for someone with diabetes automatically more than doubles, and then someone with diabetes and all the complications that come with it more than quadruples. We can make a difference by telling our employees about the pre-diabetes and diabetes prevention program. As I mentioned, this program is new to Summit County, the YMCA'S program, but it's based on years of research and development. It tends to read like a novel from left to right, chapters 1 to 5. In the first chapter, the efficacy phase, this started in the late 1990s. The National Institute of Health conducted a $200 million clinical study that involved 3,000 individuals, folks that were pre-diabetic, in three groups: a lifestyle intervention group, a group that took metformin, the drug that's used to control or prevent diabetes, and then the placebo group. The lifestyle intervention group was one-on-one, one pre-diabetic person with a healthcare professional, and no expense was spared to help that person prevent diabetes. And guess what? The lifestyle intervention program worked. It worked so well, it was almost effective, and in some cases more effective than the drug metformin. So the study was stopped because it would have been unethical to continue it. The New England Journal of Medicine wrote about this, and you have that in your packet of information. The Y was not involved at that particular point in Chapter 1. In Chapter 2, the validation phase, the National Institute of Health funded the Indiana University and the YMCA of Greater Indianapolis. They said, okay, this is what the intervention program looks like. It's a great program, but it's too expensive to roll out to the average individual. So can the YMCA put together a group setting, 8 to 15 people, and have the same results? Yes. The answer was yes. They were able to increase activity minutes, and they were able to decrease body weight for a fraction of the cost. In Chapter 3, the YMCA went to the Center for Disease Control, and they said, hey, this worked in Indianapolis with a hospital. Can it work in another community at another YMCA without the hospital involvement? Nothing against hospitals, but just trying to see if this can work in another community. Louisville YMCA, sure enough, it worked. Chapter 4, the YMCA of the USA began to be involved in this at a larger role than it had previously done. They were able to launch a partnership with the Center for Disease Control, beginning to build a national infrastructure, because ultimately the goal was to get this program into every major community where there is a presence of a YMCA. At this particular time, in Chapter 4, there were probably about 30 or 40 YMCAs that had been trained to provide the program. In Chapter 5, that's about when the Akron YMCA began to learn about the program and get more involved in going through the process of determining the need and whether we had the ability to launch and sustain the program, whether or not we could bring partners together to the table. And we signed an agreement in 2014 with the YMCA of the USA, and now have joined more than 252 YMCA's across the country to help make an impact on diabetes. One of the most exciting things that recently came out of Washington was a report from the Center for Medicare and Medicaid Innovation. They had been conducting a research project with 17 YMCA's across the country, and the idea was, could this program work for people that are 60 and older? And would that have an impact on Medicare costs? And the answer was yes. In 2018, the largest payer, Medicare, will begin to provide this program, the YMCA's Diabetes Prevention Program, and many, let me back up, and many other programs that are based on the CDC's model, that will begin to be a covered benefit within Medicare. Lisa, Karen, anything else to add to the need for diabetes? Hopefully we convinced you that it's a major need, and now what I'd like to ask is for Karen to come up and tell us more about the program.
Okay, so what is the YMCA's Diabetes Prevention Program? Well, it's led by a trained lifestyle coach. It is a one-year program, and the program is broken down into different sessions. So the first 6 months of the program, there are 16 weekly sessions, and after that it moves to every other week for three or more sessions. And then in the second half of the year, the second 6 months, they move to monthly sessions. So it is an entire year. We want people that are going to be fully committed and are ready to make that lifestyle change in their life. The program is open to anybody. You don't have to be a YMCA member to enter the diabetes prevention program. And it is a CDC approved curriculum. Okay, so how does somebody come into the program? Well, you have to be at least 18 years old, so you have to be an adult. You have to have a BMI, body mass index, which is a height-weight ratio greater than or equal to 25. And then you can also get one of 3 blood tests done by your trusted healthcare provider. And also gestational diabetes, that qualifies you as well. If you haven't had that blood test, we do have a qualifying risk score that we are going to do in a second here, and see what your scores are and if anybody is willing to share that. So actually, let's do that right now. So in the middle of your tables, they're upside down with pens on them. If you guys could kind of just pass those to each other, and we'll just take a couple minutes, fill those out. Shouldn't take too long. Remember, this is a HIPAA compliant program, so no peeking at your neighbor's scores. Would anybody be willing to share their results? What was, if you want to share, yeah, go ahead. What was your 16? Okay. Were you surprised by that? No? Okay. Anybody else? Yes, sir. 9. Okay, right. And you can see if you score a 9 or higher, you could be eligible for the program. Were you surprised by that? No. Not really, huh? No. Yeah, okay. Does anybody have a score that would possibly qualify for them for the program and is surprised by your number? No, everybody knows their numbers, huh? All right, well, this is such a really helpful tool for people to evaluate their numbers and if they're eligible to come into our program. So if anybody wants to take this back to their employers, we can certainly send this out in an electronic version. So just touch base with one of us at the end and we can certainly get that out to you guys. All right, well, thank you for taking that. Okay, so back with that blood work that you can get done at your healthcare provider, You can see here we've got 3 different blood tests that you can have done, and you can see what the ranges that they have to fall in that would qualify a participant to be eligible to be in our YMCA's diabetes prevention program. Okay, so down to the trained lifestyle coach piece, and Larry touched on this a little bit. What does a trained lifestyle coach do? Well, they work in a small group, like Larry said, 8 to 15 participants. So it is that nice, small, quaint group where everybody gets to know each other. They create a motivating environment, very friendly, non-competitive, and they act as a facilitator. They're not here to have all the answers. So I am a trained lifestyle coach. If you are all my participants and you asked me a certain question and expected me to give you the answer, I'm not going to. I'm going to throw it back to the entire group of the 6 to 15 participants, and then they work together to come up with different ways and think about how that person with the question can reach their goals. So everybody really works together every session all year long. They certainly support each other. There are goals that the participants have to set at every single session, and they have to report back the next time they go to their session. So then over that year-long, the program for the whole year, the accountability truly is transferred to that participant to make that lifestyle change and for them to be able to go out and have the knowledge and have the ability to maintain their goals that they have reached within the program. Okay, so as Larry said, there are 2 program goals. The first one is to lose 5 to 7% of their body weight in the first 6 months and then maintain that weight loss within the second half and beyond through the program. The other goal is to work up to 150 minutes of physical activity every single week. And I think it was Donna early that said, just get moving. We're not CrossFit. We're not hardcore aerobics. We're just, like she said, take a walk. If you have a dog, take your dog on a walk every day. Ride a bike. Go on the Metro Park trails. Just get moving. We're too sedentary as a country. So just get up and move. And then every week, participants will be able to move up to that 150 minutes per week. And it's gradual. We don't have you in week 1 or week 2, doing that number every single week. So it's a gradual thing. We get it. It's a lifestyle change. All right. So one of the facts, which I love this one, programs like the YMCA's Diabetes Prevention Program has reduced the number of new cases of type 2 diabetes by 58%. 58%, that's huge. And then 71% in individuals who are over age 60. So our program data. So this is local Akron area YMCA. So Summit, Medina, Portage County data. As Larry stated, we started just about a year ago. So June 2015, we have held 5 classes. Our average class size is 8. We have had 2 classes on YMCA sites and then 2 at non-YMCA sites. So the program does not have to be run at a YMCA. We can come to you. We're mobile. We're portable. As long as the classroom or office or meeting room, whatever it is HIPAA compliant, has to have a closed door, we can come to you. So we want to make this easily accessible to everybody. So again, our lifestyle coaches will come out to you guys. And then the bottom 2, you can see the how people have come into the program, how they have qualified. So 64% have come in through the having that blood test through their healthcare provider, and then 55% have taken that risk score that you all just took a minute ago and have qualified and come into the program that way. All right, so our demographic breakdown. The average age of somebody who comes into our diabetes prevention program is 51 years old. And then you can see the breakdown with the ages there as well. And then so we have about 41% of participants that come in that are low income. They need some financial assistance. They need a stipend to come into the program. The program costs $429 for the entire year. I always like to break it down and say it's about $17 per session. And it's not a lot of money for a lifestyle change and to avoid all the complications that diabetes brings. But if somebody can afford that, we have help. We have a grant through Summit County Public Health, who's ultimately through ODH, Ohio Health Department, that has supplied that. So we are lucky enough to be able to help our participants enter the program when they need a little extra help getting in there. All right, so our average weekly session attendance, Akron average versus the national average. You can see up there, we're above the national average at 14.6 versus 12.6 for the attendance piece of it. So that's really, really good.
What does that mean, 14.6? What, people?
Let me go back a second. Hold on. Yep, so it's 16 weeks that are so the first, in that 6 months, there's the 16 weekly sessions, and so that's the breakdown of the weekly sessions.
Is anybody held to attending the full course? It's paid for, or the stipend is?
Say the first part again.
Are people held accountable for attending the full course or making?
Yes, we need people who are fully committed, and they're expected to attend all the sessions.
Or what?
Well, and part of that is the vetting process prior to someone actually being allowed to start the program. So if I determine that I'm pre-diabetic, I'll tell Karen I want to be involved in the program. She'll spend time with me making sure that I'm ready to make the commitment to be involved in the program as best we can.
Yep.
Two people talking together. It is difficult from the standpoint that we can't demand that somebody go to every session, but ultimately Karen will do follow-up calls with folks. If we see somebody that doesn't show up 1 week, we'll call them and say, hey, what's going on? And then make sure that they get to the next session. And then certainly in that small group setting, Donna mentioned this earlier, one of the ways that she stays active is she gets with a group of people that expect her to be at a certain location to work out together. So the accountability of the group is extremely important in making this possible. So the average, ultimately the goal is for those folks to get all 16 weeks in. We know that doesn't happen in every case. We have somebody on the panel, one of our program participants, that will talk about his commitment to the program. But does that answer your question? Ultimately, we want people that are committed to the program because it is evidence-based. We want to make sure that people complete the program by going to all 16 weeks and the other sessions after those first 6 months.
Yeah, and I do spend a lot of time with people on the phone, really trying to assess if they're ready for this. And some people are kind of back and forth, and we might make a recommendation that come back when it's ready for you, when you're ready, when it works for you.
I would say one of the things that the county's done, if you're looking to bring this program to your organization as an employer and offer it to your employees, you gotta have the employees put some skin in the game, okay? So the cost of the program is $429. The county, we haven't done this particular program, but we've done other similar programs where employees have to pay a portion. So maybe they pay $50 or $100. If they attend all the sessions, they get their money refunded. So eventually, it could be 100% covered for the employee, but if they don't meet the goals, they either have to, they lose that money, or they even have to pay the full cost of the program if they sign up, and now they've taken a spot for somebody else. So that's kind of the way we promoted it, and I think that you're gonna get participation. We've had similar programs. We've done diabetes programs. We're looking at the Y program as well. And and I can tell you, I was surprised at the attendance and the people that went, and they loved it. I didn't have a problem with our employees not going to the programs, so I just wanted to share that.
Thank you. Excellent point. Yes.
So we have it in Richland County, and
Mhm.
we paid for it through our employee, that you call them vitality points. We got people points, and they were paid, but they had to attend 85%, and that was required.
Okay, right.
That was motivating.
Yeah.
Or they didn't.
Right, it is, and that's perfect. You want them to have that, like she said, the skin in the game, or else,
You have to keep going.
yeah,
It's a great-
it makes them a little more accountable. So for sure. Thank you for your question. Yes, please.
To the fees, so say it's paid up front, but you determine they're at a crossroads where they're really not ready. Is that banked and held for them, or is the money's reimbursed, like the balance reimbursed back? How does that work? If they paid the $429
Mhm.
and you find out 4 weeks in that they're not engaged, they're just not ready right now?
Right. So probably Lisa can speak a little bit more to that.
So we have had instances where we have refunded money because a person will start to hedge. Well, I have this vacation, I'm doing a remodeling project, whatever the reason. The vetting process takes some time. Just because they qualify doesn't mean they'll attend, and attendance equates to program success. So we have said, maybe this isn't the right time for you, we can revisit it again later, because we don't want to set ourselves up to fail. All our data gets reported to the CDC, we want to be in good standing, our program is endorsed and approved, so we want to do our job to make sure that we look at that very important factor, and if that's someone's personal commitment.
But I think your question, if I got it right, was, okay, so I pay $429 and I get into it in 4 weeks and then I drop off. In that case, we'd certainly work with individuals on a one-on-one basis. If there's a hardship, yeah, the Y would do some kind of reimbursement. We do have some folks that self-pay, meaning they paid the $429. All of those folks, if they're paying $429, they're coming to the program. We have some other situations where we have set up payment plans where someone could pay an amount down and certainly begin the program. If they drop off, it wouldn't necessarily be a refund for the program, but we wouldn't continue to have them paying for the program. So hopefully we're getting people that want to be involved in the program up front. Where we have, Lisa will talk about another payment plan that's called the Pay for Performance Plan, which is essentially what some insurance companies want to have in place. That's another scenario that Lisa can talk about. But yeah, ultimately, if they pay $429, in most cases, they're going to see their way all the way through the program. If the company pays the $429, I like what Wendy said, there's got to be some skin in the game if somebody else is paying for that. Does that help?
Okay. Yes, please.
So if you're a current member of the Y.
A Y member.
And
Mhm.
you want to engage into this program,
Mhm.
is there a discount or is it included in the membership? I understand that you said you give stipends to people who can't afford it.
Mhm.
However, what about those people who are current members and they want to engage themselves into this program?
Excellent question. They would still have to pay the whole $429. Yes, but I want to add this. So we do give a complimentary temporary membership to all of the participants who come into our program, starting at week 5 up until week 15. So you can go to any of the YMCA's, and that's just to, help jumpstart, help move towards those 150 minutes of activity every single week. So that is definitely a perk.
Yeah, and if I could elaborate on that, the reason we as a local Y can't discount somebody that is a YMCA member, I mentioned that we have a license with the YMCA of the USA on this program, and YMCA is kind of a unique organization. Each local YMCA across the country is its own organization, so we do set our own fees and prices. except for this program. Because it's a nationwide program, YMCA USA has a mallet over our head and have said you cannot discount this to YMCA members. I don't agree with that, but that's the way it is. YMCA has set a price point of $429. Whether this program is in Akron, Ohio, or San Francisco, it costs $429. And we are not in an ability to discount it for the Y members. Sorry.
All right.
How did you come up with $17 per session and the $429?
Because there are 25 sessions. Yes. Yeah. Okay, so our back to the Akron average versus the national average ratio. So up there is our average weekly physical activity minutes. So you can see that we are above the national average in that range too. 173 minutes versus 158 nationally. Okay, so food tracker completion. We have every single participant fill out a food tracker. We have them write down every single thing that they eat and drink, everything that goes in, so that makes them really well aware of what they are eating, and really just kind of gives them proof, hard proof right there on paper of what they're eating. A lot of us mindless eat, so this really just is a little reality check. And so they have to do that every single session, and you can see that compared to the national average, we have a 68% rate of completion of those food trackers every single week. Partial food track, we do get people that do partially fill them out for the session or for the week. We're 7% versus 5%. And then incomplete, there are some participants that do not complete them, but we are doing well compared to nationally as well, as only 25% of ours participants are not filling those out compared to 31 nationally. Okay, so we also have participants fill out an evaluation to let us know what their thoughts are on the program. How are they doing? So with participants who have reported reducing their portion size, almost 82%. I think that's a wonderful number. 82% also reported improving their overall health, and then almost 73% have reported increasing their activity. They are doing those 150 plus. A lot of people exceed that 150 minutes every single week, so they are doing very well. We've got wonderful evaluation data from our participants so far. Okay, all right. Well, now I'm going to hand it off to Lisa Ennis, our Executive Director.
Good morning.
Good morning.
Oh, that was great. I appreciated that. So, my colleagues have talked to you about the epidemic we're facing as we're trending toward diabetes in this country, and that there is a solution. So, your employers, many of you here today in our audience, what's the age of your workforce? Are they young, middle-aged, older? Well, I fit that last category, the 50 and older. How about your workforce? What does it look like? Yeah. What we know is that the older we get, the more expensive it is to take care of ourselves. We have risk for certain diseases and things that just happen to us as we age, and those costs to you as an employer go up based on age alone. So you heard Karen talk about the prevention program, and yes, we have the supporting data that prevention works, but it makes sense too in terms of dollars and cents. The next slide I'm going to show you is a compilation of data provided by United Health Group, so a national insurance company. And they looked at 3 years worth of data for folks in that magic age category, 50 and older, who are at high risk for diabetes. And this is what, there we go. This is what they found. So 15 cases of type 2 diabetes were prevented. Look at all those work days. 162 were prevented. 11 folks did not progress to the need for blood pressure or cholesterol medication. And how about that 20 good years of health? And almost 100,000 in healthcare costs were avoided. Health in the workplace. This is something that you're all embracing. You're here. Summit County Public Health talked about their vitality points. This is something that they're on board with already, and many of you have something in place very similar. You also probably have what's called an employer-based healthcare model. That means you as a company pay for the employee to be insured on a percentage basis, and they pick up a percentage of that. That might be an 80-20. You as the insurance would be 80% paid by the employer and 20% the employee. A 70-30, you know, there's some variety, but that's the employer-based model. What you'll find is that your insurance premiums vary due to the risk of your employee's health. Again, dollars and cents. But there's some other benefits to promoting health in the workplace, not just in terms of cost and cost savings, but it makes you a more competitive employer. You want to attract and retain the talent. You want to hang on to those folks. You want to take care of those folks. It means something to your employees. The YMCA has a corporate wellness contract with a company in Twinsburg. And this company comes to the YMCA and they do on-site fitness classes. We go to their place of business and participate in their health fair. And what we've noticed is their numbers are high. They have high attendance in the classes. They enjoy being together outside of work, improves their working relationships, and it tells them, it's that repeated message, my company's taking care of me. They're doing this for me. In this particular case, the company's CEO participates with them, and I was participating. It was a group run. We were all running as part of this particular program. And the CEO runs by, and the HR director was running with me, and she pokes me and she says, and that's our CEO. He's not just talking the talk, but literally walking the walk. And that gives you the ability to shape your culture and those norms. But why partner with the YMCA? So why should you do that today? Well, in regards to the YMCA's diabetes prevention program, we're not a standalone. As you heard my colleagues talk about, we have the infrastructure in place at the national level. There is a senior director of chronic disease prevention that has direct oversight of this program. And not only is there, in essence, Dr. Matt Longjohn, we have technical advisors that are assigned regions throughout the country to make sure that our quality control is in place, that we're doing things the same throughout the country. The YMCA is dedicated to strengthening communities through healthy living. This is part of who we are as an entity. And we have developed through the years of research, when Larry showed you the efficacy slide, we understand this program, we know how to make it work. Because where we have the support at the national level, we need it at the local level too. So we work with a group of ambassadors to make sure we're doing everything we possibly can to make this program available. I'd like to recognize Dr. James Salem. He's an endocrinologist at SUMA. And Akron General's Dr. Mike Fistic, he'll be part of that panel later, and he is also a referring doc. He refers his patients to the YMCA's Diabetes Prevention Program. Also, the American Diabetes Association, Access Point, Ritzman Pharmacy, and you'll hear from John Dimmick a little later on as one of the panelists as well. Summa Health. Certainly appreciate Ann Wargo at the helm of our Community Advisory Board. Summit County Public Health. Wonderful opportunity today to present to all of you. Thank you, Summit County. And also the United Way of Summit County. They were instrumental in providing some startup funding to launch this program. So many folks have been helpful to allow us to deliver this program. So Kim, you asked a question earlier, really about accountability, and I'm going to get to that. There are two ways that you as employers can partner with the YMCA. Certainly someone can come in as a self-pay and pay that $429. But you as employers are more interested in these other two methods. So we can enter into a contract. So the Akron Area YMCA can sign a contract with you, and we would invoice you directly per participant. But we could decide together jointly what that is going to look like. We might decide to break it up into two payments. You'll pay us $250 per participant if they attend session 1, and maybe the balance after they've attended session 5. We know statistically that if a person attends the first 4 sessions, they are highly likely to complete the program. So we know this, so we work very, very hard to make sure the attendance is in place. If we decided to take this type of direct payer approach, we would also decide how to verify eligibility. We prefer to use the blood value as the means of qualification. So we might call up our friends at Ritzman and work with John Dimmick and have A1Cs done for your employees, so we can use that blood value. The other reason we prefer the blood value, certainly it's truer in terms of the diagnosis qualification, but we also are working to be and remain in good standing with the CDC, and the blood value test allows us to do that. I like to mention again, you've heard Larry and Karen say this, but we, like a doctor's office, like a healthcare provider, must be HIPAA compliant. And for those of you who don't know what that means, it's the Health Insurance Portability and Accountability Act that was made into law in '96. We are subject to HIPAA audits, and our staff are trained annually in HIPAA compliance. I think a good example of this, Larry mentioned earlier, this direct payer approach, is the contract that we're getting ready to embark on with Summa Health for a 75-person pilot. One of the things that they have asked for, and we made it part of the contract, is they want their classes to be closed. So that means Summa-only employees. And we are very easily able to do that for them. Anyone have any questions about this particular model? The other model is a little more complicated, but it is certainly open to you here as well. And this is, Kim, this is the pay per performance model. So we as the YMCA have signed a contract with a third-party administrator. You would also, as the employer, sign a contract with a third-party administrator. So we would have a three-way contractual arrangement. And the data that you would be provided would come through the third-party administrator. Either way, you'll be given output data. We'll be reporting to you in the aggregate. So de-identified data. I can't tell you Larry Griffin's output, but I could tell you how the class did and how our program as a whole did. And the things that we would report to you as an employer are attendance. We would report weight loss and the activity level, those three things. So with this particular PAYOR approach, your employee might go to the doctor and they would receive a diagnosis of prediabetes, and that diagnosis would have what's called an ICD code. They're diagnosis codes. So that might be 790.29 for the abnormal glucose. Well, then we know for insurance purposes, you're eligible. Then we would be using a claims form, and then we would have the corresponding CPT code, which is current procedural terminology. This is something that's owned by the American Medical Association, but if you're familiar with the claims-based model, there's got to be a diagnosis and then a treatment. And the treatment would be the YMCA's diabetes prevention program. Now, I talked about Matt Longjohn earlier at the Y of the USA level. They have really achieved a medical coup. Matt went before the American Medical Association, and we, as the YMCA, have been granted our very own CPT code that would be utilized. So this model is a model where you can leverage your buying power as a company to nudge your insurance company. Hey, we want this. We'd like this to be made available. Because it's you who have the power to do that as employers. It's not Karen, Larry, and Lisa as three people. Certainly an option and an example of this at the national level is United Healthcare. When Karen is looking to set up classes, because we already work through a third-party administrator, we will find people that have been auto-enrolled in our classes by the third-party administrator, and we know when we see them that they're folks that have United as their health insurer. What can you do now? So maybe you're not ready to sign a contract for this program with the YMCA. Well, how about inviting us out to your next health fair? Let us begin to develop relationships with you, your employees, and also call Karen, make an appointment with Karen. Tell her you want to have brochures available and posters and other marketing materials so that you can start communicating how important prevention is. We can also come and do classes on site at your location. It certainly sends a powerful message when you're having folks from the community come in and recognize you as a company that want to do these wonderful, healthy things for people. I think at this time, I will ask my colleagues to stand up. I want you to be thinking about some more questions. And while you're thinking about your questions, because I know you have more, there's a little video clip that really shows what the program is at its essence.
Is diabetes inevitable?
Type 2 diabetes doesn't have to be your destiny. With the help of one YMCA program, participants like Scott Carter are actually trying to stop the disease before it starts.
It's behavioral, management type of program. The first part of the program deals with
watching fat intake. And then as we get further in the program, very seriously involved with the exercise piece.
The program is a year-long commitment. That might sound intimidating, but when Scott's doctor told him he had pre-diabetes, he knew he needed to make some changes.
There was some fear, there was anger, and not directed at anybody, more to myself, and just a disappointment. I was about to turn 50 and knowing that this was not who I was, that this didn't identify me. And I knew that it was preventable. And so that's where I really took ownership of my health.
And that's exactly what Scott did. Over the course of a year, Scott lost 53 pounds. A key aspect of the program is learning how to measure your food and keep track of what you eat. Scott uses an app on his phone.
I'm on the road a lot, and so to have my phone with me and to be able to track what I eat, because nothing's taboo. It's just, you know, if you eat a ribeye steak, you need to know how many calories and how many fat grams a ribeye steak is. It's okay, but you just got to know that that might be the only thing you eat that day. Having the will, the accountability, and then also having the ability to track it in an easy way.
Knowing how to measure and track food has helped Scott avoid some tricky situations.
That's one of the aspects of the class that it began to let you think about menu choices before you ever went out. So if you were going to a restaurant, that you would possibly, you know, that you would gravitate more to the fish and chicken rather than to the red meat.
Another element that helps participants is the group support.
The group is so powerful with each other by keeping each other accountable. They bring in recipes for each other. I'm just amazed at the support they give each other. I think the group is the most powerful piece of all this.
Scott isn't the same man who entered the program a year ago. He doesn't just have more energy and a slimmer appearance. He also feels like he's able to be a better husband and father.
Took my daughter out to California, and there was a 50-foot alpine tower. And a year ago, I would have never attempted that. But I scooted up that thing like in record time. She was proud of me. You know, I think as a dad, you always want your kids to be proud of you. And so that was a, sorry. That made me proud to be her father, because she was proud to be my daughter.
Kelly Bowman, CNN.